So I have my patient Maddie back in the patient chair, and I am going to start treatment. I'm going to start with the Explorer. I'm going to detect for deposits. Okay. All right, so I'm going to start off with number 7, making sure that I'm holding the instrument in the modified pen grasp, making sure that I do have a light pressure on it. And starting at the midline, I am going to be starting to go sub, making my way into the contact area and working my way down. I'm going to flip, and I'm going to be starting again at the midline, making sure I'm fulcruming at least 1 to 2 teeth away from the tooth that I am working on, just so I don't get in the way. Coming up on my fulcrum, starting at that midline, going subgingival, rolling into the interproximal area, coming down the contact. Of tooth number 7, I am going to be starting at that midline, making sure that I go subgingival, making sure that I have a strong fulcrum, and working and rolling into the contact area and coming down. Now I'm going to flip, again making sure that I have a strong fulcrum, starting at that midline and assessing the tooth, rolling into the contact area. Okay, now I'm going to do a posterior tooth. All right, so I'm going to be starting with her molar, making sure that I'm using the correct end, starting at that distal line angle. I'm going to be going subgingival, making sure that I have a strong fulcrum, assessing, rolling into the contact area and coming down. And then starting that distal line angle and rolling back. Okay, so now I'll be doing the lingual aspect of the tooth. Starting at that distal line. Starting at that distal line angle, going sub, rolling into the contact area and coming down. And then starting at that distal line angle and rolling back, making sure that I am assessing the whole tooth and using my wrist activation. And now I'm going to be working on the mandible. So I can't, normally I would have my patient's chin down, but with this Typodont, I am not able to do so. So making sure that, again, I have a strong fulcrum, starting at, and then I'm up on my fulcrum as well. I'm going to be starting at that midline, going subgingival, and using my wrist activation and rolling into the contact area. And flipping, starting at that midline, rolling into the contact area and coming parallel and not getting my instrument stuck. Okay. And now the back of the lingual aspect of the tooth. Again, starting at that midline, rolling into that interproximal space. Flipping, starting at the midline, making sure I'm up on my fulcrum, and rolling into the interproximal space. Okay, so once I'm done detecting for deposits, I am now going to start scaling. So I'm going to start with my anterior sickle. Since my patient did have deposits that I detected. So again, I'm going to be starting at the midline, putting the tip third on the tooth, making sure I have a strong fulcrum, that I'm up on my fulcrum, and using my lateral pressure and rolling into the interproximal space and coming up. And then again, starting at that midline, strong fulcrum, and rolling into the interproximal space. Now the lingual aspect of the tooth, again, starting at that midline and coming up, or coming into the rolling into the interproximal space. And on the other side. And making sure that I am ending parallel to the tooth. Okay, I'll do one more. Go ahead, do number 7 again. Starting at that midline, making sure that I have a strong fulcrum ring 1 to 2 teeth away. And applying that tip third and rolling into the interproximal space. Starting at the midline and rolling into the interproximal space. And now another instrument that I would be using is my universal curette. This can go anywhere in the mouth. It is one of my favorite instruments. So I'm going to demo on or scale a molar, making sure that I am using the correct end of the instrument. So I'm going to be starting at that distal line angle, having a strong fulcrum 1 to 2 teeth away, and using my wrist activation, using my lateral pressure, and coming into the interproximal space, ending parallel. Then I'll go back, starting at that distal line angle and rolling into the interproximal space. Now the lingual aspect of the tooth, I'll flip. And then starting at that distal line angle, making sure that I am subgingival and using my wrist activation and rolling into the interproximal space, ending parallel. And then again, starting at that distal line angle and ending parallel. I'm going to be scaling a premolar, and then starting at that distal line angle, making sure that I have a strong fulcrum, and I will be rolling into the interproximal space, making sure that I am ending parallel, coming out, starting at that distal line angle, coming up on my fulcrum, making sure that I'm staying subgingival, and rolling into the interproximal space, ending parallel. Now for the lingual. Okay, so starting at that distal line angle and coming up on my fulcrum, I'm going to be rolling into the interproximal space, coming out, again, starting at that distal line angle, I'm going to be staying subgingival and rolling, ending parallel. Okay, so once I am done scaling, I will start to polish, and I'm going to be using a fine grit Profi paste. Once I am done polishing all the facial, buccal, and lingual and occlusal surfaces and incisal surfaces of the teeth, I will have my band instructor come and do my final check. Once the final check is done, I will sign up for a restorative, Once restorative is complete with the dentist, I am going to apply a fluoride varnish. This is Spearmint, and I'm going to put them on the facial. I'm going to dry the teeth. I'm going to apply to the facial, lingual, incisal, and occlusal surfaces and give post-op instructions.